Okay, let's get into it. So, when you picture a pregnancy checkup, what's the first thing that pops into your head? Probably some high-tech ultrasound machine, right? Or maybe the whoosh whoosh sound of a heartbeat monitor. Well, what if I told you the most powerful tool in that entire room isn't a piece of technology at all?
Yep, that's right. The single most critical part of any prenatal visit is, believe it or not, the conversation. Before any instruments are ever picked up, the real foundation of care gets built with dialogue, with trust, with understanding. In an age where we have all this incredible medical tech, the most powerful tool is still just human connection.
And look, this is so much more than just friendly small talk. It's actually a very structured, very intentional process. It's all guided by empathy and respect, and it really sets the stage for everything else that's about to happen. I think this is so interesting. This is a direct instruction from the manual for medical students. It just hammers home that the human element is absolutely crucial. See, effective care, it starts with making the patient feel heard, respected, and safe. And this isn't just about being nice. It's literally the key to getting the accurate information needed for a healthy pregnancy. So once that foundation of trust is there, the questions can get really specific. This is where the doctor basically opens up their playbook, and every single question is like a strategic move designed to map out the entire pregnancy and spot any potential risks way before they become actual problems.
And you have to understand, this is not a random interrogation. Every single question has a crystal clear preventative purpose. So for instance, when they ask about age, especially if you're over 35, they're thinking about the risk of less flexible tissues, which could potentially complicate labor. Asking about your job, that's to screen for any exposure to harmful chemicals. And a history of heart issues is absolutely vital to know because pregnancy puts a huge strain on the heart. It's all about being proactive. So how in the world do doctors and nurses keep track of all this vital info quickly and make sure everyone's on the same page? Well, they use a special kind of shorthand, a code that you might even spot on a medical chart if you look closely. It's called the PARA score. So here's how it breaks down. P is for parity, which is the number of full-term births. The first A is for the number of preterm births. R, and this comes from our source text, represents previous pregnancies that ended in miscarriage or termination. And that final A is for the number of children currently alive. So in just 4 little letters, a doctor gets a complete snapshot of a patient's entire obstetric history. It's incredibly efficient. Okay, so after that deep dive of a conversation, we move on to the hands-on physical exam. This is where the body itself starts to tell its own story about the health of both the mother and the baby. And while it's a full head-to-toe assessment, let's just zoom in on one really common symptom that shows you just how much a doctor can learn. So let's take a super common and relatable complaint. A patient mentions, "My feet are so swollen, I can barely get my shoes on." Now, to the patient, this is just a major discomfort. But to the doctor, it's a potential clue. Right when a doctor hears this, they're already running through a mental checklist. Is this just the normal, mild swelling that's super common in later pregnancy, or could it be something more? They'll check for what's called pitting edema. That's when an indent actually stays in the skin for a bit after you press on it. This one simple check, especially if you pair it with a blood pressure reading, can be an early warning sign for a really serious condition called preeclampsia. And now we get to what might be the most fascinating part of the whole exam. It's a classic, totally low-tech technique that uses nothing more than a skilled pair of hands to figure out the baby's exact position. These are known as the 4 Leopold maneuvers. Okay, let's walk through this. First up, step 1, the fundal grip. That's feeling the very top of the uterus to figure out if that's the baby's head or its bottom. Then, step 2, the umbilical grip. The hands move to the sides to find the baby's back, which feels like a long, smooth surface, versus all their little limbs. Next, step 3 is pollex grip. That's one hand right above the pelvis to confirm which part of the baby is lowest. And finally, step 4, the pelvic grip, which tells the doctor how far the baby has started to descend into the pelvis. What's so incredible here is that these 4 simple steps create a complete 3D map of the baby's position. It's a brilliant blend of skill and science, all done without an ultrasound. So, when you start to put all these pieces together, the thoughtful conversation, the detailed history, the careful physical checks, and these skilled hand maneuvers, it becomes really clear that a prenatal visit is so much more than just a quick check-in. And that's the real goal here, something our source guide points to again and again. It's not just about collecting data points. It's about building a real collaborative partnership. Because an informed patient who actually understands the why behind each step,
That's an empowered patient, an active partner in their own healthcare journey.
And all of this leaves us with a final thought to chew on. Does demystifying this whole process, understanding the why behind every question and every touch, actually create a stronger, more trusting partnership between a patient and their doctor? And could that, in the end, lead to better health for everyone? Definitely something to think about. Thanks for joining me.